Welcome to Mind Mentor. In this video, we will discuss about tuberculosis. It is often abbreviated as TB, is a contagious bacterial infection caused by the bacterium Mycobacterium tuberculosis. It primarily affects the lungs, but can also affect other parts of the body. Tuberculosis has been a significant global health concern for centuries, and while efforts to control it have been successful in many parts of the world, it remains a major public health issue in some regions. Here is a detailed explanation of tuberculosis, covering its causes, symptoms, transmission, diagnosis, treatment, and prevention. 1. Causes and bacteriology. Causative agent. Mycobacterium tuberculosis is the primary bacterium responsible for tuberculosis. There are other related mycobacteria such as M. bovis and M. africanum, which can also cause the disease. Transmission. TB is primarily spread through the air when an infected person coughs, sneezes, or talks, releasing respiratory droplets containing the bacteria. Inhaling these droplets can lead to infection. 2. Symptoms. Tuberculosis can present in two forms. A. Latent TB infection, LTBI. In this form, the bacterium is in the body but not causing symptoms. It is not contagious. People with LTBI may develop active TB later if their immune system becomes compromised. B. Active TB disease. This is the form that causes symptoms and is contagious. Common symptoms include persistent cough, chest pain, coughing up blood, fatigue, weight loss, fever, and night sweats. 3. Diagnosis. A tuberculin skin test, TST. Also known as the Mantoux test, this test involves injecting a small amount of TB protein under the skin and checking for a reaction a few days later. B. Interferon gamma release assays, IGRAs. These blood tests measure the body's immune response to TB infection. C. Chest X-ray and sputum smear. Imaging studies and sputum samples are used to diagnose active pulmonary TB. 4. Treatment. Tuberculosis is treatable with antibiotics, but treatment typically involves a combination of several drugs to prevent the development of drug-resistant strains. The most common drugs used for TB treatment include isoniazid, rifampin, ethambutol, and pyrazinamide. The treatment usually lasts for 6 months or longer, depending on the severity and type of TB. 5. Prevention. A. Vaccination. The Bacillus calmette-guerin, BCG vaccine is available in many countries and can provide partial protection against TB, especially in children. However, it is not universally effective. O. Infection control. Preventing the spread of TB in healthcare settings and households is crucial. This involves proper ventilation, wearing masks, and separating infected individuals. O. Treatment of latent TB. Identifying and treating individuals with latent TB can prevent the development of active disease and reduce transmission. 6. Global impact. Tuberculosis remains a major global health concern, particularly in regions with high prevalence, such as sub-Saharan Africa, Southeast Asia, and parts of Eastern Europe. Factors such as poverty, malnutrition, and HIV co-infection contribute to the spread of the disease. Efforts to control and eventually eliminate TB continue, with a focus on early diagnosis, effective treatment, and vaccination. The emergence of drug-resistant strains known as multi-drug-resistant TB MDR-TB and extensively drug-resistant TB XDR-TB presents additional challenges in the fight against this disease. It's important to note that TB is preventable and treatable, and early diagnosis and proper treatment are essential to reducing its impact on public health. Thanks for watching. If you like our videos, please like and subscribe to our channel Mind Mentor.